Morning everyone, my name's Martin Evans, I'm one of the editors of the BJS. I'd like to welcome you to this session on how to write a clinical paper. Why go to the trouble of publishing? I mean, you've travelled to come on this course. I presume you've got an interest in publishing, but what's your motivation for doing that? When I first started publishing, my motivation was about my CV, in all honesty, and I have to say, I would now say that's the least important reason to publish, but then I do have the benefit of a few lines on my CV, and I think at your stage it is, you know, points win prizes, lines on CV win prizes. Any other reasons, anyone? Why did you become a doctor? You must have been asked this in medical school, at interviews. So why did you choose to become a doctor?
Because I wanted to try and help people.
Yeah, and that is an obvious reason. I also think that's an obvious reason why you might want to do research, and more particularly, you know, write that research up. Because unless we do research that improves patient care, we're never actually going to improve the care we deliver on a daily basis. Okay. So things that I came up with are on this slide, and we've been through CV. We've talked about improving scientific knowledge. And I also think for somebody in a junior stage of their career, the bottom one I think is perhaps the most important. If a junior asked me today, why should I do some research, I would say partly because it's hard, and you might think, well, if it's hard, I don't want to do it, but it teaches you a lot of skills. You know, if you're going to get a research project from, you know, an idea through to being published in a journal, you're going to have to jump through lots of hoops, be it ethics or approval, doing the study, writing it up, getting statistics, and it's a team working thing. I think that teaches you skills that are really helpful for any career and life generally. I suppose the final one, and you know, this is slightly egotistical, but self-promotion. I certainly wouldn't be stood here talking to you this morning had I not published stuff in my career. You know, I wouldn't be an editor of BJS, so it does give you an opportunity, a voice box to promote who you are and what you are. This slide lists all of the sorts of paper or types of article I could think that you could publish, and vaguely I would say they're in an order that I would say from easiest to hardest to publish. If you look at my generation, most of my contemporaries, and certainly my first publication was a case report. Now, for your generation, I think things have moved on. Case reports are relatively difficult to get published in what I would call mainstream journals, unless you're willing to pay to an open access journal to get it published. I have to say, my advice to anyone today who comes to me and asks about research is get involved with collaborative projects. You know, there's been a massive explosion in collaborative research in the last decade. And personally, I think that's really quite exciting. I think we're producing some really powerful and big studies that wouldn't be possible without collaborative research. This is something that we published last year from a group. Some of the authors of this are very good friends of mine. And the reason I've put this up today is it exemplifies a couple of things about publishing. It's a research letter, so I don't know whether any of you are familiar with the BJS's research letters, but essentially it's 500 to 600 words, 5 references, and we introduced them at the start of the COVID pandemic. And the reason that we brought them out was we wanted to try and give a vehicle for authors to publish anything that was COVID related very quickly and get it through the process within a couple of weeks at most and get it out there. Now, they have been so successful, I would say, from the COVID perspective that we've continued them. COVID research, at that time, we were accepting most things that came through, and I think that has now dipped, and that tells you another thing about publishing, that timing is really important. You know, at the start of the COVID pandemic, if you wrote up anything that was COVID related, it was likely to be published. If you try and do that now, it probably won't be. Do you have something worth publishing? Now, you'll probably hear me say this a couple of times this morning, but my absolute top tip in terms of publishing is find somebody to work with who has published a lot. You know, in any geographical area that I've ever worked in, there have been guys who publish a lot and some guys who don't publish anything. Now, at your stage of your career, I would encourage you to go and find that person in your area who publishes a lot and just say, you got anything you want me to write up, or you got a project that I want you to do? And because they're experienced at doing it, they will know how to guide you to get to where you want to go. If somebody offers you a project, you know, most training jobs that I've ever experienced are time limited. So you really need to look at something and say, is this feasible for me to get something out of it? You know, there's no point in starting a project that's going to take 10 years to come to fruition, because you're not going to be around when that comes to the end. So look at anything you're offered and say, can I actually do this? If you're not sure about it, I bounce it around amongst your friends. You know, if somebody asks me to do something and I'm not sure, I ask one of my colleagues, one of my friends, what do you think about it? And I encourage you to do that if you're offered projects. In my experience, usually the best research is actually the simplest research. Usually something that has got 1 or 2 aims at most. Something that's got 15 or 16 aims is going to be a very muddied manuscript to try and write up, and a very muddied and clear piece of research. At the start, I'd encourage you to try and create a title. Now, the reality is it's unlikely to be the title that you end up using for your manuscript that you submit. But if you start that process at the very start of your project, I think that gives you a sort of focus about what this project is about and keeps you on track of where you're going with it. And final thing, and there's nothing more disheartening than getting to the end of a research project and taking it to a statistician and them saying, if you'd recorded this data, it would be perfect, but without it, it's meaningless. And the point of that is really, when you're trying to get something published, I would encourage you to get involved with a statistician right at the very beginning rather than the end of your project. So in terms of the title, this is for actual submission now. Most journals have a certain style, so for the sake of argument, BJS wouldn't have a question in their title. You'll see some journals that will ask a question, you know, does aspirin cause cancer, question mark, and then that's the paper. That wouldn't work for BJS, and this is about you working out where you're going to submit your research to and then tailoring your title to it. It's not the be-all and end-all, I have to say, because I think most journal editors would quite happily change the title if the manuscript is very good. Titles should be brief, you know, at most 10 to 15 words. If you've ever seen a title that runs to 30 or 40 words, it is a mess, so do keep them short. Perhaps obviously it needs to predict what your content is about, and this comes back to keywords. When you're asked to submit a manuscript, you're asked to include keywords. It's important that you get those into the title. Mainly, I would argue, to describe what's going on, but also because most search engines will use those keywords to let other researchers identify your work. So if you want to get your work cited, well, it needs to have the keywords so people can identify that that was what the study was about. So what do we look for when we get a manuscript in? What do you think we look for? What sort of things do you think we don't want when you submit stuff to us? Any thoughts?
I think you want to know whether the content of the manuscript will appeal to the readership of the journal.
Yeah, absolutely. You know, BJS is, you know, the old bastion of general surgery, really. You know, breast, endocrine, GI surgery, vascular surgery. So, although occasionally we take something different, if you gave us something from neurosurgery for the sake of argument, we're unlikely to publish that. You know, you need to take that to a neurosurgical journal. Okay. Any other thoughts about things that we do or don't want as editors?
Clear and well written.
Yeah, well written is important. You know, the honest answer to that is, as an editor, you sometimes have borderline calls to make. There are some manuscripts that are really very good and you will accept whatever they look like, and there are some manuscripts that it doesn't matter how well they're written, you'll never accept. But the ones in the middle, it's important to write well, because if you're in that sort of tipping point between acceptance and rejection, human nature dictates that if I look at that and think, oh, it's going to take me 6, 7, 8 hours to sort this out, and it's a borderline call, well, sorry, the borderline call is somebody else can spend 6 or 7 hours sorting that out. Any other thoughts? So the things that I came up with, well, topical, and this comes back to the comment that we just made about COVID. You know, 2 years ago, if you were writing something on COVID, it was topical. You could argue it is still topical now, but the moment for getting quite basic research published about COVID was 2 years ago, not now, I would argue. Novelty is great, but the reality is I've seen very, very few papers that I would say are truly novel. Most times it's been done before, and I have to say one phrase that a lot of authors use that does get under my skin a little bit is, this is the first time this has ever been done, because I'm prepared to bet it's not. You know, if you self-congratulate yourself in the discussion about how great it is and it's the first time, you'll probably find it's not, and you're lining yourself up to be shot down. As we discussed, well-written, and that well-written includes, in my eyes, focus. As we said earlier, the best studies are the simple ones, and through that you then get a focused manuscript. Final thing is whether it's going to be cited or not. Now this is reality, that as journal editors we are measured by the impact factor of our journal up to a point. So, you know, if it's really great science, I would hate to think that any of us wouldn't take it because it wasn't going to be cited. I think if it was a really good manuscript that we think is really important, we would take it. but it does come into the decision making. In terms of what we're less keen to see, well, unfortunately for people who are at the early stage of their career, retrospective research is often the easiest to do, but it is the one that's most liable to bias and problems with it. So I'm not saying don't do it, because I think, you know, that's what you're going to do at the start of your career, but the reality is you're unlikely to get something retrospective published in the really top end, high impact factor journals. Uncontrolled data, again, for the same reasons with bias. If you've got a study of 3 patients, having something that's less attractive than a study of 850 patients. You talked about language is important and when it's been done before. So, some advice about where to publish if you want to avoid being like this couple here. Well, there's a few things that I think you need to consider when you're thinking about where you're going to publish your work. First, I would say, is general versus specialist. So, as a colorectal surgeon, I know we've got colorectal disease, we've got diseases of colon rectum, we've got techniques in coloproctology, or you've got the general journals that take colorectal stuff, so Annals of Surgery, BJS, JAMA Surgery, and where you send it to is probably going to be dictated by the quality of it. If you've got a really high quality randomized controlled trial in colorectal surgery, that will probably go to one of the higher impact general journals. If you've got something on 100 people having hemorrhoid surgery, probably that's going to end up in a colorectal journal. Impact factor is going to be an important driver for you, I suspect. You know, you aspire to get your research into the highest level impact factor you can. I would also say you need to be slightly realistic about this. There's no point a series of 50 patients having a hernia repair. Did they get a wound infection or not? There's no point sending that to the really high impact factor journals, because you're going to get shot down with that and you're going to get rejected repeatedly. So probably it comes back to that comment about advice from somebody who's done it before, where you target in terms of that. Influence may be important to you. I'm a member of the Royal College of Surgeons of England, and they produce a journal every month that is relatively low impact factor. I think the impact factor is about 1.5, something like that. But having said that, when I've published some stuff in there, I've had more comments about that research in the coffee room in work than I have when I've published something in the BJS. And that's because every surgeon who's a member of the Royal College of Surgeons of England reads, or should read, that magazine, because it comes through your door every month. And therefore, if you want to make a political statement, for sake of argument, you might want to talk about training or some difficulty, then probably that's not a bad place to try and publish that. I think at your stage, when, as we discussed earlier, lines on the CV are important, the speed of us making a decision, I think, is something you probably want to consider. You know, BJS prides itself and works very hard to try and keep our time from the moment you submit it to the time us making the decision. We aim at 21 days. We can't always keep to that, but that is on average what we're aiming for. I am aware there are some journals out there who can take a year to make a decision on a manuscript, and I just think that's unacceptable. You know, the world has moved on in a year, and you may have lost your moment to try and publish that. So most journals should publish how long it takes them to make decisions. The final thing you might want to consider is open access publishing, and we might be able to discuss this later, but I do think in 10 years' time all research will be open access publishing. I think that's the way the thing is going. You as a consumer of research will not want to pay to access it. The model at the moment is that libraries or you pay for the access. I think, you know, the world is not in that way anymore, and I think you will find that more and more people will be publishing with open access journals. When you start to write, I think it is hard. Even as somebody who's written a fair amount, I still find it very difficult to actually do the first couple of lines. And a couple of pieces of advice. First, just sit down and write something. Even if it's not very good, it's much better to fill a page and then edit it than to sit there at the blank screen thinking, what do I say? Or typing the first word twice and then deleting it and then retyping it. I think it's something you need to give time and space to do. It's not something I can do between cases or between MDT and clinic. It's something that I need to, you know, just be me in a room somewhere to do. So do create that time for yourself. Whatever you're looking to write up, this I personally think is a fantastic resource. I don't know whether any of you have come across it, but this is a website, the Equator Network, and it really will give you a shopping list for any sort of study that you want to do, be that a randomised trial or a case report or anything. So you can have a look at that. In terms of how to write, well, my mother was an English teacher, and I have to say she would despair of the way that I would encourage you to write scientific English. You know, she would spend hours trying to get me to make my sentences longer with more punctuation and more descriptive words. Well, you've got to remember that when you're writing for scientific community, and a lot of you guys are in this situation, your first language is not English. So if you use really complex language, it can be difficult to understand. So keep it simple. Keep the sentences short. You know, one of the things I think we do as editors consistently is shorten sentences. You know, when I'm going through a manuscript, I will chop things down. Critically look at every sentence when you come to editing it, and Des will probably go through this at the end, but there are lots of words that we use that are unnecessary. If you can remove those, it makes it a lot simpler. Wherever possible, BJS style is to write in the third person, so that is, we avoid things like we or our. Now I am aware there are other journals who are quite happy to accept that, and again, it's not going to be a deal breaker whether we accept it or not, but we would ask you to write in the third person. Tenses are important, and again, when you go to review it, you can work out is it in the past, present, future tense. Try and keep it consistent throughout, all right? And punctuation, again, back to my mother, is important because it impacts on the meaning of stuff. So what we're going to do in the rest of it is that Malin, Vile and then Des are going to break writing down into these sections, and we'll go through it. Any questions at this stage?